Hi, I'm Dr. Ali Bengzon. I specialize in Oculoplastic surgery, lacrimal surgery, and orbital reconstructive surgery. Ptosis is a condition where the eyelid is drooping, the eyelid itself. Not just the skin, but the actual eyelid is drooping, which makes one or both eyes smaller than what it should be. Ptosis can either be congenital, meaning it's inborn. When the baby comes out, you notice right away that one eye is smaller than the other. Or it could be acquired, which is the more common situation when it comes out because of age. Or it can be caused by trauma. All of these conditions, whether it's congenital, acquired, or caused by trauma, can be solved with surgery. In the case of congenital ptosis, it's a little bit trickier because you're dealing with a child. So the most important thing to do with congenital ptosis is, first of all, the child has to be assessed by our pediatric ophthalmologist. Why? Because we have to assess the visual development. If the eyelid that's drooping is severely drooping, meaning covering the entire eye so that the child is unable to use that eye visually, then it becomes more of an urgent matter. We will probably have to do the surgery at a younger age. However, if the eyelid is only slightly drooping, meaning it's not covering the entire eye, and that the child is able to still use that eye visually, then we can afford to wait a little bit longer until the child becomes perhaps maybe 6 or 7 years old before they start going to school. In acquired ptosis, most of the time it happens in the elderly when they get to about 60 years old or above. It will interfere with their vision. When the ptosis obstructs the eye, it blocks your vision and you are unable to see out of that eye. And most of the patients, they come in complaining of this, that they can't use their eye, mahirap manood ng TV, mahirap magbasa, or hindi na sila nakakamaneho. These are all regular, normal daily activities that are hampered or hindered because of the condition of their eye. Obviously, if the ptosis is covering your vision and preventing you from doing normal activities such as reading, driving, watching TV, etc., that's a good enough reason. It's really a simple procedure. So, in ptosis, ang problema sa mata, itong muscle na to. This is called the levator muscle. At ito yung mahina. So, sa repair ng ptosis, ang ginagawa namin, binubuksan namin to, hinahanap natin yung muscle na to, and ito yung ina-adjust namin. We shorten the muscle, thereby lifting the eyelid by degrees, depending on how much lift ang kailangan. There are a few ways, a few types of surgeries that we do, and the type of surgery that we choose depends on the measurements, depends on how severe the ptosis is. If it's mild ptosis, meaning maybe a drooping of about just a few millimeters, the procedure for that is very quick. It can take 30 minutes, outpatient procedure, local anesthesia, and you're back to work or back to your regular activities in about a week. But the more moderate, severe types of ptosis require a little more complicated types of procedures, and it might take a little longer to recover from, say about 2 weeks to 3 weeks. Still not so bad, considering that this will give back some function to you and will improve your outward appearance as well. The procedure can also be done using the laser. And again, the advantages of the laser are faster surgery, less bleeding, therefore less bruising, less swelling, which all translates to a quick recovery and faster resumption of normal daily activities as well.